I've previously discussed the effect of a decreased blood pressure on cardiac output, and in the previous presentations we discussed that through increasing heart rate and increasing stroke volume, we increased cardiac output. This was basically this part of the concept map here, and it involved these responses of the heart. Now what we want to look at is what is going on systemically, and so we're going to be paying attention now to what's going on here at the arterial level. So this is where we're going to be looking at vasoconstriction and vasodilation, and this is going to be altering the systemic vascular response. And remembering that our initial stimulus is a decrease in blood pressure, so what we want to do is increase the systemic vascular response. And the combination of an increased cardiac output and increased systemic vascular response overall is going to increase blood pressure as indicated right here. So we have two components. We have the cardiac output, which is being dealt with by the heart, and then we have the systemic vascular response, which is being dealt with the arterioles. Let's quickly review the response loop. We have a stimulus of a decrease in blood pressure. This decrease in blood pressure is going to be detected at the baroreceptors at the carotid sinus and also here at the aortic arch. These are going to be sending afferent signals to the control center, which is the cardiovascular control center. In the previous presentations, we looked at the response of the heart to this, and we looked at there was going to be increased sympathetic to the autorhythmic cells and the myocardial contractile cells with a corresponding decrease in the parasympathetic, and also that there would be an increase in the sympathetic to the veins, increasing the venous return. Please note here now that the cardiovascular control center is also sending out efferent signals via the sympathetic nervous system to the arterioles. Now this is going to be affecting the systemic vascular response and in the end increasing blood pressure. Okay? Stimulus is decrease in blood pressure, response is increase in blood pressure. Also note that it gets a little bit more complicated because not only is the sympathetic nervous system affecting the arterioles, we also have the hormonal response here of epinephrine. So we're going to have a combined electrical or nervous response at efferent pathway, and we'll also have a hormonal component to this. And specifically, this is when we're talking about the fight or flight response. So in the next slide, we're going to zoom in on this and take a look at it. Please note that I am distinguishing between the essential organs and the non-essential organs. There's going to be capillary beds going through both of these types of organs. The essential are those that are essential for the fight or flight response, and this includes the heart, skeletal muscle, and liver because it's storing glucose. The response of the essential arterioles is going to be vasodilation. The response of the non-essential arterioles is going to be vasoconstriction. This is accomplished by having neural and hormonal input. So let's just take a look at what that input is, the efferent signals coming to these effectors, the arterioles. So the sympathetic nervous system is going to be sending out an efferent signal to the non-essential arterioles via alpha receptors responding to norepinephrine, causing vasoconstriction. This is then going to increase the systemic vascular resistance and therefore increase blood pressure. Remembering that this overall scheme is in response to a decrease in blood pressure, or you can think of in the fight response, you want to increase blood pressure. So that is the role of the neural component to this response. In addition to this, you will see that the cardiovascular control center is sending out another efferent signal right here to the adrenal medulla. Okay, the adrenal gland sitting on top of the kidney. The adrenal medulla is then going to release the hormone epinephrine right here, and it will bind to beta-2 receptors on the essential organs, causing vasodilation. This is because you want to increase the blood flow to these so that it can supply these organs with the oxygen and nutrients that it needs. So let's just go back again to this vasoconstriction that occurred in the non-essential. It accomplished two things. It increased the blood pressure. Okay, so we want to have an increase in blood pressure so that we can get the blood to those essential organs. And by constricting, it also diverted blood to those organs that needed it. So this was a redistribution of blood from the non-essential to the essential. The flow of blood through the essential and non-essential organs are also going to be controlled by regulating precapillary sphincters. So taking a look here for the non-essential, we can see that the precapillary sphincters are contracted. Once they contract, they divert the flow of blood from the capillary beds through the met arteriole. Whereas in the essential, there is going to be a relaxation of these sphincters, and therefore the blood will actually flow all through the capillary bed, supplying those tissues and organs with the appropriate nutrients and oxygen. In summary, in response to a decrease in blood pressure, the baroreceptors at the carotid sinus and at the aorta are going to send afferent signals to the cardiovascular control center, and it will respond by sending efferent signals not only to the heart, which controls heart rate, stroke volume, and cardiac output. It will also send efferent signals to the arterioles. It's going to send out an efferent signal to the non-essential via the sympathetic nervous system, causing vasoconstriction, and it will also send signals to the adrenal medulla, which then respond hormonally by releasing epinephrine and causing vasodilation. The difference in these responses is due to the different receptors. The non-essential is going to have alpha receptors responding to norepinephrine. The essential will have beta-2 responding to epinephrine. Overall, the vasoconstriction diverts blood from the non-essential to the essential. It also increases the vascular resistance and increasing blood pressure. So if the initial stimulus is a decrease in blood pressure, the response is an increase in blood pressure, which is the correct homeostatic response.